About 1 in every 2 children in Kenya experience violence. Violence that takes various forms, including child marriages, defilement, FGM, physical, sexual and emotional abuse, among other forms. To what extent have we as a country prioritized efforts to safeguard our children against such abuses? This is the focus of our special discussion as we seek to share ideas on how various players can join efforts to alleviate violence against children. I'll be moderating this discussion, and my name is Abi Agida. To participate in this conversation, you can join us on our social media handles at KTN News KE. You can also join us on Slido and as well as on Zoom. We'll be sharing the details with you on the bottom end of the screen, and we hope to give this very important discussion due justice when it comes to protection of children in the country. I'll be steering this discussion with an able panel, and I'd like to introduce my panelists for this very important discussion. First off, we have Madam Lilian Dodzo. She is the National Director for World Vision Kenya. She has over 15 years experience in international development, planning. She has extensive experience in Africa, having worked as the National Director for World Vision in Sierra Leone, Mali and Mauritania. As such, she has a wealth of knowledge and experience in program management, humanitarian operations, communication and advocacy work, as well as faith and development engagement. Welcome to the program. My second guest this moment we have is Mr. Chege. He's the Country Director of Child Fund Kenya. He has over 20 years experience in development work in a number of African countries in various capacities such as Program Development Manager, Assistant Country Director, Program, and currently as a Country Director. His core competency areas include resource mobilization, people management, program design and execution, organizational development and capacity building, and formation of partnerships and strategic alliances. Well, last but not least, we are also joined by Madam Massi Chege. She is the Director of Programs, Quality and Strategy at Plan International Kenya. She has a passion for child protection with a keen eye of positive discipline as a means of ending violence against children. She also has a passion in ending all forms of gender-based violence against children and young women, including ending FGM, which is a precursor to child marriages and teenage pregnancies. Well, that is just to give you a sense of the rich panel we have on the program as we discuss this very vital issue facing society, the protection of our children. Thank you so much, ladies and gentlemen, for joining us here on this special edition on KTN News. Well, I'd like to kick the discussion off with just getting your opening thoughts around how has the pandemic affected issues to do with matters touching on the homestead. We've seen a rise in teen pregnancies. We've also seen reports indicating that there's been a rise in abuse of alcohol as well as battering of children. I'd like to bring this to a quick opening, and I'd like to give Chege the first to go on this very important subject.
COVID-19 pandemic is a global crisis for child rights. When you look at what is happening in Kenya and globally, a number of kids are out of school. In fact, we are told by UNICEF that in 188 countries, schools have been suspended, and we are talking of about 1.6 billion children that are out of school. In our country, we are talking of close to 15 million children that are not in school. And that in itself casts doubt on the future of these children. So that concerns us and me as an organization.
All right, thank you so much. Let me bring in Madam Dodzo to also weigh in.
Very much. COVID-19 has had a very negative impact on children. especially in the area of child exploitation. You'll recall that sometime back in April 2020, the justice sector operations in Kenya reported that in many parts of the country, there was over 35.8% of criminal matters that were reported that were really linked to child abuse cases. So we saw some perpetrators of offenses being close relatives of children, being guardians, and sometimes being persons living with the victims. As my colleague Chege has said, the forced closure of schools during COVID-19 really put a lot of children in very precarious situations, especially those that live in abusive families. So we saw a spike in teenage pregnancies, for example. We saw a spike in defilement to the point that the President of the Republic of Kenya in July acknowledged that, there is an increased problem of gender-based violence in Kenya due to COVID-19 and the after effects of COVID-19. He also talked about the worsened mental health issues in the community. He talked about the escalated instances of teenage pregnancies, and he even went on to issue a directive to the National Crime Research Center to start probing these issues. So this is just to illustrate to you how COVID-19 has had quite a significant impact, not only on gender-based violence, but specifically on children through child exploitation.
Thank you so much for your remarks. I'd like to bring in Madam Massi Chege as well to give in her remarks.
COVID-19, if there's one thing that we can say that has affected the protection of children in Kenya is by straining the protection system, the service delivery system within government, and also for some of the stakeholders, and the justice system. So we realized that during the COVID response, all efforts were going towards curbing the pandemic, and the government officials and even INGOs like Plan International, Save the Children, World Vision, and Child Fund, and others also, we are so focused on just making sure that we are supporting the efforts to curb the spread of the virus. That you look at the justice system, the courts closed. You could not take children into protection, those who are in need of care and protection, because of the fear of spreading the virus to other children in the institutions. The helplines 116, 1195, totally overwhelmed by the number of calls that were coming in, and the referral system was quite strained because of the number of cases that they were receiving. So the resources to protect the children, to end gender-based violence, and to provide SGBV services were quite strained. A lot of effort was made just to make sure that these efforts continued, but we know that there was a bit of a strain, and a few children could not access the support that they needed.
All right, thank you for that. Thank you so much. Very powerful opening remarks from the panelists. Let me bring in once again Mr. Chege. Of course, the situation continues to be dire, and how are actors like yourself stepping in to support children from vulnerable backgrounds? And of course, walk us through how significant has been the pandemic. How has it affected children across the country?
Thank you. As Joining Forces Alliance, which is an alliance of six biggest organizations in children development, we are focused on ensuring that children access support, whether they're at home or not. So we're looking at issues like health, issues like education, issue like child protection. As my colleagues mentioned, we are looking at community-based child protection mechanism. How do we revitalize that to make sure that children are supported and protected during this period? For example, in the case of Child Fund, we have 4 main priority areas. One of the priority areas is to ensure that children are protected from infection. And in that, we do a number of interventions, like, issue of giving masks, protective gears. The other objective, the other priority area is ensuring that children are provided with nutritious food. Because we know that now they're at home and most of the parents have lost jobs, or their caregivers are not able to do any business. How do we ensure that children during this particular period are not suffering? And we know that during the school time, some of the schools provide meals. So now that the schools are closed, most of these kids are not getting meals. So as an organization, we are providing cash transfer, where now their parents are able to provide for them both meals, medical, other social services. We're also providing food, the food distribution where it is possible. Of course, complying with the government laid out protocols of COVID and all that. The other area that we are looking at is in child protection, trying to support them from ensure that they are not exposed to violence during this period. And in that, we're trying to promote issues to do with the caregivers are supported, children are supported to be gainfully engaged and all that, and providing the material that they can give them. They can be stayed at home and engaged. The other area that we are focusing on, and we think is critical, ensuring that children are learning. And in that, we're working with supporting the government, and also providing digital equipment that can allow children to tap into the program supported by the Kenya Institute of Curriculum Development, and also provide material that they can, reference materials they can access. For example, we have cases where we find some of these children are from very vulnerable households. How do they access that? So we're providing them with solar radios so that they are able to access the Kenya Curriculum Development Institute schemes of learning and all that. So overall, that's what we are doing. The other area that we are looking at is ensuring that children have a voice, especially they have this time, that they are able to articulate the issues they have. And in that, we are working with government structures at county level, especially the area councils,
all right,
coordination on children, to make sure that children issues are brought into fore. If children are experiencing challenges, again, they are referred, they're provided referrals and supported. So I can say we have a wide range of services focused on children to ensure that even now under COVID, the children are protected, are provided for, and are guided.
All right, thank you. Thank you so much, Mr. Chege. Let me bring it back to Madam Linda. And of course, quite a host of activities being done by the Child Fund. I don't know, is this sufficient? Do we have enough capacity to reach out countrywide?
I think if we work in a coordinated way, in a collaborative way, and in an integrated way, as we've agreed to do as Joining Forces Alliance, which makes up 6 of the largest child-focused agencies, working in partnership with the local partners, area advisory councils, as my colleague has indicated, that brings together government players as well as civil society organizations, partnering with the child services departments and all other key stakeholders that are focused on children's issues, as well as engaging the community. Because as you know, violence and exploitation on children begins in the household. I think joining forces with all those key stakeholders coming together, we can make significant strides to really start reversing the trend of ending violence against children. As you can see from what Chege has said, Child Fund is doing a lot in terms of really making efforts to put in place protective mechanisms for children, working with partners as well as other stakeholders. World Vision is also involved in the same platform, in the same area, also focusing on engaging community, working with community structures, to really talk about these issues that cause violence on children, also empowering households, because you find that a lot of the causes of violence on children is really poverty. When there are not enough resources in the household, then caregivers are tempted to give up their children, for example, for child marriage. You find children on the streets. So there are various interventions that are ongoing by various organizations. But I believe that if we coordinate our efforts, if we integrate, then we can have greater influence and larger impact in terms of really turning around this curve of child abuse to make sure that our children live in protected communities, that they enjoy life in all its fullness, and that they are cared for and protected within their families and by their caregivers. So for me, it's really important to coordinate. It's important to partner, even with our donors as well as other stakeholders, with local CBOs, with faith-based organizations that are also influential in communities that are able to engage with families and influence positive parenting practices and behaviors that can really create that cohesive as well as safe environment for our children. So partnering and collaborating and integrating our efforts is important, and we'll be able to start seeing some positive strides if we approach this issue jointly and joining forces together.
Thank you. Very strategic insights there. And let me bring in Madam Chege. You work very closely with the various communities at the grassroots level, and talk to us about the scale at which the pandemic has literally affected children. Of course, parents are getting into this new world order where they've had to stay with their kids past 3 months. It's heading now to 6 months since there was a shutdown of schools. And what has been the ripple effect of this, especially when you look at issues to do with idleness among the young people, issues around abuse when it comes to some families have had their economic livelihoods disrupted by some actually being rendered jobless. How has this panned out in the last few months? If you could just give us an assessment.
Thank you very much. At the community level, I think that is where the pinch of the effect of COVID-19 is actually being felt. First of all, the first 3 months from April, when there was lockdown, you realize that most of the organizations and even government officials were not able to reach the communities and intervene in cases of child protection as we did in the past. So we depended on the goodwill of the community-based organizations, the faith-based organizations, and the government structures that are right at the village level, just to make sure that some of the operations still continued. For example, one of the biggest handles was getting support to the girls during their menstruation. You realize that the government has been providing sanitary towels for girls, and the avenue was the school. So from the schools, the girls would get the pads every month. But now with the shutdown of the schools and grounding of most operations by the government and even NGOs like the ones who are represented here, the Joining Forces Alliance, it was very difficult to get to the girls and to bring them to collect the pads. So what we did is that we made use of our suppliers, and they were very gracious. Actually, this is the one time I have seen them going out of their way. And they will deliver the sanitary pads all the way to the CBO's offices or sometimes at the chief's offices. Then we would use the community mechanisms to get to the girls, and they would come in, like groups of 5, 6, 7, less than 10. They would pick the pads and they would go back home. What we were trying to prevent is just to make sure that, the famous sex for pads does not come back to the community. Because when girls do not have sanitary pads, the story of, anybody who can be able to provide a little money so that they can buy pads, the girls would go for that. And this came out very clearly, even when we were talking to some of the young girls in Kilifi and some young men who went to one of the radio stations. And they were saying what they have seen as the effect of COVID-19 is that girls are willingly, out of desperation, going to seek out men who can be able to give them money so that they can buy pads, and sometimes even to supplement the income in the family so that the families can feed. And sometimes the parents don't even know what the girls are doing. And the boys would go to the field, and anybody who can give them, work for the day, give them 100 shillings so that they can feed their families and support their parents, they would do the same. And what that did is that it stole the childhood from these children. You realize that they were supposed to be doing virtual classes, but there is a section of children in our community that can totally not benefit from virtual classes. They don't have access to mobile phones, and even when we bought the materials from KICD and we gave them to the community-based organizations, sometimes the computers were not available and the children could not gather for the tuitions. So that is how much the children have been affected. If the parents don't go to work, then it means that the children will not have food in the evening. So parents ended up going to work and leaving all the children at home. That idleness is not very helpful to the children because they are used to a structured system within the school, and they are used to a lot of order in their lives. So when they wake up in the morning and for 12 hours, they don't know what to do with themselves. Of course, a lot of things happen. They would engage in some sexual activities just out of excitement. They will go and roam around the village without getting worried that probably they will bring COVID back home. The family structure itself is one that has really been tested during COVID. The families have been forced to be together with so much time that they don't know what to do with it. And you know that people are busy, so they wake up in the morning and just disappear, and they meet in the evening. So that staying together and getting oriented to a new way of living was not very easy for most families. You realize that there was domestic violence when there is no food on the table, and that caused a lot of emotional and psychological stress to most people at the village level, and even for us who are supporting them. The fact that we can't get help from them. And sometimes the government officers are not able to get to them, especially the Department of Services. You realize that it was a very tough time, and a lot of systems actually broke down. That post-COVID, we will have to really focus on rebuilding some of the protective systems that we had built in the past so that we can continue from there.
Thank you. And we want to proceed on a quick break, but before we get to the break, let me bring in Madam Lydia, just to also get your input, especially when it comes to the collective efforts that have been running so far. How effective have they been, and what are the gaps?
The collective efforts have been effective. If you recall that in July, the Ministry of Labour and Social Services launched a report that is talking about ending violence against children, in partnership with UNICEF, with USAID, as well as other partners. And that report really was collecting some of the causes of violence against children. So you see government working together with NGOs like ourselves, with community, with donors, to come together to really understand the issues. And as we do that, emanating from that Ending Violence Against Children report was what is called a National Response Plan, Prevention Plan, which has been developed that outlines some of the issues that need to be done to address this issue of ending violence against children. And every child-focused organization or child rights player has to align to that preventive action plan or plan of action to make sure that our efforts are coordinated and that we address the issues as joint forces in a joint way. That is the one way that will be effective. So I see that the coordination that is being done by government, and then also the partnering that is coming into play through NGOs like ourselves, through civil society, through communities, local leaders, and families even who are getting involved in this process of addressing ending violence against children, it's yielding fruit. You know, we still have quite a number of strides to make, but I really see that there's a lot of concerted and joint effort to address the issues, to make sure that we strengthen community-based mechanisms, to make sure that an enabling environment for children is created, a nurturing, non-violent and respectful environment for children in communities is being created. So I think if everybody rallies around this plan of action for preventing VAC, it's really going to be effective for all of us to really share in that vision of government and rally around it, and our efforts are going to yield fruit.
All right, thank you so much. And Mr. Chege, in brief, are you satisfied so far with the mitigation efforts being put out by JFA?
Yeah, thank you for that. I think as a coalition, I'm quite happy with the efforts that we have been able to put in place. We have put a very robust program that is funded by European Union to address the needs of children under COVID, and is being implemented in a number of areas in the country. Of course, we could do more with more resources, but one critical thing is that these 6 organizations and their partners and the government are spearheading a very critical move on having children in the forefront and ensuring children have a voice. Because the challenge we have seen in most cases is we ignore children. We don't give them an opportunity to say what they want. But I'm seeing that as a critical area where you're saying, yes, we have children. Can we also listen to them? And a good example is when there were the ongoing discussion on reopening of schools.
Yes.
I think as an alliance, we were given an opportunity to contribute to that. And we took advantage and consulted children on what they would want. Another area that I would want to cite is in June, during the Day of African Child celebrations, we had an opportunity again to involve children, especially on aspects related to justice, because this year's theme was child-friendly justice. And children came up with very, very innovative and focused areas where they think the critical players, government and non-state actors, can pray to make sure that they are also taken into account and their issues are addressed. So I think we're doing a lot, but there's still a lot that need to be done.
All right.
We need more people to come on board, more organizations, but also more resources to be able to achieve what we think is meaningful for our children.
All right, thank you.
Thank you.
Thank you, Mr. Chege. Well, on that note, we want to go on a quick commercial break. And remember, to be part of this conversation, you can join us on our social media handles at KTN News KE. You can also tag us along hashtag KTN News Special. You can also tweet me at Agina Abe as we take your questions, your views, your experiences as we continue to dissect through this very important matter. For now, we go on that quick break. A lot more coming up, especially as we shift focus to look at the numbers. Very grim statistics that we'll be presenting to you in a short while.